you very much. It's lovely to see you all today. It's nice to see some different faces. I'm Kate Lees, and I am the Health and Wellbeing Lead for Worcestershire Health and Care NHS Trust. My colleague Mina is with us, and she'll introduce herself in a minute. And a colleague Ben is due to be here, but I'm not sure he's been able to get on. So if Ben joins us, we shall see him in a minute as well.
I am here in the background, Kate, if you can hear me. Apologies.
Oh, you sound like an alien.
Maybe it's an improvement. Is that any better?
Oh, that's better. That's better. Yeah. Anyway. Mina and Ben, do you just want to quickly introduce yourselves, and then I can carry on?
Okay,
I'll jump. Oh, go on, Mina. You go first.
Okay, my name's Mina Ali. I'm a team lead for Worcestershire Healthy Minds, which is an IAP service for people with mild to moderate anxiety and depression.
Thanks, Mina. And I'm Ben Rogers. I'm Trust Lead for Psychological Interventions and Health and Care Trust, and I'm a consultant clinical psychologist by training. And yeah, really pleased to be invited along today with Kate and Mina. Thanks for having us.
So for those of you who aren't familiar with Worcestershire Health and Care Trust, we are a community mental health and learning disabilities trust throughout Worcestershire, and we also now have services within Herefordshire. So we have just under 4,500 staff, you know, a huge range of staff, doctors, consultants, admin, you know, nurses, occupational therapists, etc. And we have well over 100 sites across the 2 counties. So the things we've done to support our staff through COVID, and also find out a bit from you as well about you know, challenges you may have faced. Recognise as well that, you know, lots of different organisations are in very different situations at the moment. You know, with us being an NHS organisation, of course, we haven't had to think about actually anybody being furloughed or anything like that. But you know, there's been lots of different scenarios people have been faced with during this time. As well as then, you know, us as, you know, managing other staff, thinking about our own well-being as well. So that's something else to talk about. Mina's going to talk to us more as well about the services that can be accessed through Healthy Minds. And I think, as Olivia mentioned, anything we do mention, we'll make sure is circulated out to you afterwards, you know, with links, etc. So, my role as Health and Wellbeing Lead is all around staff. So my job is to support staff. So I sit in as part of the HR team, and I've worked for the Trust for around 15 years, and I think it's about 8 years in the role as Health and Wellbeing Lead. So as part of my normal everyday role, excuse me, I do a lot of training for staff around emotional resilience, mindfulness, getting a good night's sleep, around stress. I work a lot with our health and safety team around staff stress. I offer one-to-one sessions to staff, and also then can signpost them onto other services. So when COVID kicked off, so to speak, Ben and I, we worked closely together generally anyway, but as part of that initial phase, we worked with a number of the other wellbeing and resilience framework. So that was our part of our response to COVID, and it was based around 4 main domains of work. So communication, supporting staff wellbeing and helping to build resilience, our response, and then recovery and development. So thinking about the whole sort of COVID journey, if you like. So Ben, I'm sure, will tell us a bit more about that in more detail in a minute. But I think the main things really to think about during COVID is actually, it's the nation as a whole at the moment is more anxious. And so then obviously, and people have lots of different anxieties, lots of different stresses throughout this time. So one thing we thought about was actually the different levels of support that may be useful for staff. So again, that was 4 different levels. So that's self-help, you know, apps, online support, books, reading that people could do. Then also the peer support. So actually just having, one thing you miss sometimes, you know, if anybody's having to work a lot more from home at the minute, is those corridor conversations, that support you get from just having a bit of a chat with one of your teammates. Supporting conversations, so that might be conversations with myself as health and wellbeing lead, with our chaplain, with managers, and then that fourth stage is actually more professional support, which is then maybe referring on to other services. So it's you know, acknowledging that people have different anxieties at this time, and depending on personal circumstances, you know, they're very varied for all of us, and acknowledging actually that they are all valid. You know, an example for our team is that we are being encouraged to work from home, although I have come into the office today. For some people, great, love working from home, feeling protected, feeling safe. You know, actually I'm safe within my own four walls. For other people, feeling very isolated, feeling guilty for not being in the office with their colleagues, or out on the front line, if you like, with nursing staff. So again, it's different stresses for different people around a similar situation. Something I think Ben's going to talk a bit more about is actually the point where, does somebody need a chat and a couple of days off? You know, and just a bit of a chance to offload, or actually, when does it get to that point that additional support is needed for them? You know, when is it that you might recommend other services for them to be able to access? Obviously, with COVID, we've had to do things very differently. So we've had a long relationship with a counselling service who provide counselling for all of our staff. Ordinarily, of course, that would be face-to-face. The same with the Healthy Mind service, you know, that's face-to-face intervention. So we've had to think very differently about how these things are available and ensure staff are able to access them. For us, with our counselling service, we've been very lucky that actually, because of support being available over Zoom, over telephone, actually staff have been able to access a counsellor a lot quicker maybe than they would have ordinarily. So ordinarily it would have been about a week's turnaround, whereas now people are being spoken to. Well, it's trying to think about business as usual. We're trying to, there was a stop on appraisals, for example, straight away when we first got into COVID. Appraisals were stopped, but actually we're trying to reintroduce now, because it's the importance of things like appraisals, regular supervision, one-to-ones. Thinking about the use of risk assessments. We have a stress risk assessment as well as our general risk assessment. Thinking about sharing good practice. So within our teams, like I said, we've got a huge workforce, and actually some teams have introduced different things that actually then they found useful as to keeping in touch, helping with their stress and anxiety levels. So we've tried to share those around. One of the main things for us throughout this has been the communication with staff, and actually trying to share messages down to staff, you know, as to where support is available, those different levels of support, etc. I feel I've whittled on quite a bit now, and I can see Ben's itching to speak. So Ben, do you want to just go over anything I've missed?
Thank you, Kate.
Or, you know.
I always hate following Kate because she's so good at her job and always explains things so clearly. So I will try and carry on in that vein. And I mean, I think Kate's done a really good job of explaining some of the levels of support. And one of the things that we know about COVID is we're seeing a really big range of responses in the general public and in the workforce across the UK. And it's really important to hang on to that thought. Not everyone within this pandemic is going to need high level support or kind of mental health support, psychological support. And that's okay. Some people may require that, but certainly not all. And I think, as Kate has explained, there's different levels of support available. And part of the reason I find that really interesting is, you know, I remember as an undergrad in psychology learning about Maslow. I don't know if you guys have heard of Maslow's hierarchy of needs. And quite often what we look for is our basic safety and security to be in place before we start looking for other sources of support. And COVID is exactly the same. So in the NHS, what was keeping a lot of our staff feeling really safe and secure was knowing there was going to be enough PPE to go around, that the trust was really clear about how they were working and supporting patients and how to support vulnerable people in the community. It's also, you know, the basics for all of us, like Are we taking breaks? Kate mentioned, you know, there's a lot of self-help support we put out there. I'd really be curious to know how well all of you guys have been sleeping during COVID, and have you had worries about your employees and work? But all of those things are really important to have in place. So when we're supporting employees and our colleagues, making sure that all those really basic forms of self-care are in place. And one thing that I guess we know in mental health, and Mina will know too, and may want to talk more about, is, you know, self-care works differently for different people. We're not all going to respond to the same things. You know, you might hear about certain things like mindfulness being really trendy at the moment, great ways of managing your mood and emotions. I love mindfulness, it's fantastic. I have plenty of friends who that's not their thing. You know, for them it might be practical stuff like sport and exercise. It might be engaging in an activity where they're learning a new skill, and that helps their self-esteem and confidence. But I guess, you know, within this, it's really important to bear in mind that there is no right or wrong here. There is no one size fits all. All of our responses to COVID are equally valid. Whether you have staff members in the same office with kind of similar roles, some may be seeming to do really, really well and be fine. And as Kate said, you know, some people are loving home working and getting on with that. Others are finding it really frustrating and difficult. One interesting bit of feedback we've had in our trust that I'd kind of urge others to think about here too is feedback from staff who are trying to juggle multiple responsibilities. So obviously at the start of COVID, the government took the decision to close schools, to bring children back home. Schools were struggling to respond to that in terms of having online support quickly up and running. So for lots of parents out there, they were trying to work with schools to get their kids up and running. They were trying to get used to using this new bizarre thing called Zoom that they may or may not have come across before. So some of the pressures actually we found in our staff were not just to do with work. It was also how on earth were they balancing being a nurse at work, a mum or a dad at home, you know, still managing to kind of hold down all the other responsibilities, and not least be able to get the shopping on time as well, because, you know, all the delivery slots were full. So, you know, checking out with staff about all of these basic, you know, fundamental things to us is really, really important, because it might not be work stress that's causing people the biggest worry at the moment. And I guess, as you'll have heard in the press, you know, one of the big messages going out at the moment is also it's okay to not be okay. We know at times of crisis we all respond differently, and there may be someone in an office who's on the surface seeming to do really, really well and managing well, actually underneath that is struggling and not letting you know. There may equally be someone who is you know, really finding it difficult to get on with some of the regular things at work because there are so many other pressures. And I guess what we know is none of these responses are abnormal. They're all kind of normal in the context of a pandemic. We're all responding in different ways, and that's okay. But it's kind of important to help people know, if you're not feeling okay about COVID-19 and what's happening, that's all right too. That's fine. And in fact, it's better to know that and to be able to support someone and for them to have someone to talk to about it than for that to be a kind of a hidden thing. So I guess, you know, coming back to this idea of levels. So, you know, as an employee, you might be able to support people with just finding out about how home life is, how they're managing, you know, multiple responsibilities, how you're helping them to have basic safety at work, which could be PPE, a parking space, you know, getting their lunch. It might be kind of being able to signpost people kind of a next stage onto things like basic information and self-help. And there's lots of fantastic stuff that's going on nationally. We will, before the end of the session, make sure you've got all of our website details at the Health and Care Trust that do have lots of really useful signposting information for people about self-help resources to do with managing, I guess, what we'd call emotional well-being. So that's a bit like with your physical health. Looking after your mental health requires a bit of practice and kind of, you know, a bit of emotional exercise. I guess then above that, as a trust, we have a number of online resources available. Mina's service have done some fantastic work over the years, bringing in organisations who've been able to provide online treatments like CBT. True to it being COVID-19, my dog's barking in the background at the postie at the door, so I do apologise about that, but there you go. Just to prove a psychologist can have his stress levels go up as well. So I guess beyond that, we might then be thinking about what happens with mental health services. Now, as we've said, it's likely to be a very small number of people who are likely to need that high level of support, but actually it's really important people know how to get to that. So I think when Mina talks, she'll say a little bit more about the service she works for and how to access that. But our trust has pulled together some new website details that does have a lot more information about not just the self-help resources, but the online resources available to people and mental health. And Kate did say before about this idea of noticing the difference between what's that kind of stress that we're all feeling and a mental health condition. And I guess one of the things that I'd urge all of you to think about is just having open conversations with your employees too. You know, I don't think anyone's expecting that employers are there to do mental health assessments of your staff, and actually it's probably not particularly appropriate to do that anyway. But it's really important, if you're worried about someone, just to ask simple questions like, how are you doing? Are you aware of support that's available and out there as well? And helping to break down some of the stigma around mental health. We know kind of, I think the statistics you often hear are kind of 1 in 4 adults are likely to experience a mental health condition at some point in their life. That may well be an underestimation. And I think all of us have had times in our lives where we have struggled with our emotional health, even if it's not to push us to the level of kind of having a kind of a diagnosable mental health condition. But again, some of the things to kind of be looking out for when people are just noticing, are you seeing changes in someone? Are they seeming more low and tearful? Are they starting to withdraw socially more than they might normally do? Are you starting to notice them saying more unusual things? Now, all of those things can be symptoms of something else, like the dog barking at the front door, pushing someone's stress levels up, and all of a sudden they start, you know, getting flustered and talking in unusual ways. That might be explained by something else. But I guess, you know, often we can feel anxious about asking people about mental health because of a worry that, could I make it worse? And I guess an important thing to know is all the evidence out there is we don't. And particularly we've had people say to us in the past, if I'm worried someone's feeling suicidal and I ask them about that, are they more likely to try and harm themselves? And we know from research that's absolutely not going to happen. And actually one thing that often does happen though is we get anxious about asking this stuff. So people end up living with a lot of really difficult distress that they don't have anywhere to kind of explore that. I'm mindful that I've talked quite a bit and we're starting to kind of get more now into, I guess, thinking a bit about mental health. So I wonder whether it would be a really helpful time to hand over to the fabulous Mina to hear a little bit about some of the services that operate in our trust to support in that regard.
Well, I feel under pressure now. Right.
He is fabulous though.
So Worcestershire Healthy Minds, so we're a service that have been going for about 10 years in Worcestershire, and we've got bigger and bigger and bigger, and at the moment we've got about 70 staff just in our little section. So we've got a resource site, Worcestershire Healthy Minds, which I am going to send to Olivia to send out these websites addresses. So on there we have got some self-help guides, and we've got some COVID information. And these are things that people can access themselves, look at the self-help and work through. And also on there, we have a self-referral option. So somebody can either self-refer online to our service, or they can ring our number and have a telephone assessment, book a telephone assessment then. So the sort of things that we deal with. So this is a little bit further than, like Ben was saying, about talking to people and being helped by that. This is, right, I've talked to people, I've maybe talked to my GP, and I'm still struggling, and I feel I need that little bit more support. So that would be then when they'd be thinking about coming to our service. So at the moment, we've got an online service which is called Silver Cloud. So there's 2 options there. There's one which is what we call unsupported. So somebody can have the Silver Cloud options, and it's got different things on it. So dealing with anxiety, which obviously is very rife at the moment. Generalised anxiety, so that's when people are just worrying about everything and anything, not anything specific. Health anxiety has probably risen quite recently, so there's self-help on health anxiety. So there's those sorts of options, and the unsupported people can just get on there, they can use it 24/7 and just do it. If they feel that they need that little bit more support, they can refer into our team, and then we can offer actually 2 weekly appointments via email to support what they're doing on the internet. So our staff will look at what they're doing and offer them guidance and advice to help them get a little bit more out of this online service. So that's our Silver Cloud option. And then we've got 3 different lots of staff. We've got psychological wellbeing practitioners, and they're what we call low intensity CBT therapists. And they will offer the support for Silver Cloud. They'll also offer psychoeducation and some help with exposure to get people to start to do more, because basically people might start isolating, so they'd be like looking at, right, how can we get people doing that little bit more, being a little less anxious. So they can offer telephone support. We still are having an option if people only want face-to-face. We're putting them on a separate waiting list, and unfortunately we don't know how long they're going to be waiting, but there still is that option for the future. But we've moved to telephone and WebEx. So we don't use Zoom, we use something called WebEx, which is similar. So there's that option. We also are hoping to get our groups and courses up and running on WebEx events. So we've already got one that we're going to hopefully restart in a couple of weeks, which is called our Acceptance and Commitment Therapy group. That is going to be, it's about learning to accept feelings and thoughts and to then move on with what we want to do in life. So accepting we might have negative thoughts, we might have anxious thoughts, but we still have got goals and we want to move forward towards that. So people can self-refer on our site if they're interested in doing that. We're hoping that our calm and anxiety and boosting mood course will be up and running shortly via WebEx events. And that's a lower level, so it covers anxiety, stress, worry, depressed mood, so a range of different things. It's a 6-week course. And I forgot to mention, sorry, the ACT one is 10 weeks. We also have an Overcoming Worry group, which we're hoping to get up and running shortly as well. But for the time being though, we also have a counselling service. So people who are struggling with changes to their life right now, or maybe struggling with perhaps a bereavement, relationship problem. So they can offer 6 to 8 sessions of counselling. Again, at the moment it's by telephone or WebEx. And then we have high intensity CBT. So this is where somebody might have a more entrenched problem. So the PWPs would have people that it's a fairly new problem. So probably a lot of people who might just be struggling from COVID might go to our step 2. But if someone has had a longer term problem, and they might have had this problem for a while, but because of COVID, it might have made it even worse, they might be considered for our step 3 option. So that'd be, we deal with specific phobias such as needle phobias, blood phobias, vomit phobias. We deal with depressed mood, so moderate to severe depressed mood. We'll deal with anxiety, health anxiety, post-traumatic stress if it's a single incident that somebody's had. And we are anticipating, that because of COVID, we might get a lot of more people that are actually going to be traumatised. And it could be from the fact that they wasn't able to be with their loved ones when they died, or they weren't able to go to the funeral. So we are actually anticipating that come the end of this, we might be getting a lot more referrals for people with trauma due to COVID deaths and things that have happened. So we also deal at step 3 with body dysmorphia, and I'm trying to think, social anxiety. And we're anticipating as well that at the moment people with social anxiety are probably quite happy because they're not having to force themselves to mix with people that much. But obviously it's going to make it more difficult for them when we go back to normal for them to get mixing again. So that might be somebody, that might consider referring themselves to our service, because it may be that they're actually going to deteriorate during this period and they'll need building maybe their confidence back up. So as I've said, we do offer a wide range of services. Some people aren't suitable for our service, but then we would refer on. So if we think that they've got some needs that are a little bit more than what we can deal with, We have an enhanced psychology department, and we also have what we call a community mental, that's changed the name. I was going to say the old name then. Community assessments and recovery service. So for people who are really struggling and might have secondary mental health care needs, we'd be passing to them. We also have a primary care service where there's some nurses and social workers and OTs that will do an assessment and maybe signpost either to secondary care, or may think actually we're going to give them a little bit of support and they can come back to our service. So there's that as well. So another resource that we also recommend for people is something called the Centre for Clinical Interventions. It's an Australian site, but it's really good. And again, I'll send the link to Olivia. And this is where it's self-help booklets, and they're really quite in depth, and they cover a lot of topics. So people can actually, if they don't want to, they feel, I don't want to get into mental health services, they can go on this website, look at their problem area, and then it gives them psychoeducation, and then it gives them advice as if they were having therapy themselves. And the resources on CCI are a lot of the resources that we use ourselves in Healthy Minds. So that's a really good site if people feel I've got the motivation and I can get on with it myself. We've also got the Worcestershire Well-Being Hub, and that's it's a website, but it's also people can ring in, and that gives lots of information about local resources. So not just about us, it might be what other things are happening in the community. So that's another good resource to give to your staff. So there's a wide range of options. And I don't know if I've missed anything, Ben or Kate.
No, I told you she was fabulous. A great overview. I guess one thing just to add to what Mina was saying, Mina gave a really lovely description there of some people with social anxiety might be doing really well at the moment and actually not feel the need to us. There could be lots of other people who are really struggling at the moment because of needs that are meaning they're more socially isolated, without some of the regular support that are the things that would keep them emotionally okay. And one of the things we are aware of is we've seen a huge drop in referrals for mental health services during COVID. Now, we think that's probably because people are understandably concerned about leaving the house with social distancing, the need to focus on keeping themselves and their families safe. But I guess it does leave us with a bit of a concern that possibly there are people out there who may well be struggling and not reaching out for support in the way that they normally would. And one of the things that's really nice about what Mina's described there, I think, is the range of services that we have that actually don't even need people to leave the house. You know, there is a lot we're trying to do online now. That's not to say that we aren't still offering face-to-face. We are where it's needed. But actually, you know, for some people who might be really anxious about leaving the house for fear of contracting coronavirus, COVID-19, or equally worried about, you know, not being around to support loved ones, there are lots of other ways they can access support at the moment as well. So a message we're just putting out to everyone is, you know, if you're in need of help, reach out for it and ask, because actually we've got lots of services who are doing our best to kind of meet the needs of everyone across both counties at the moment. But I don't think I have anything more insightful to add. I think Mina's done such a good job there of covering what we offer as a trust.
I just remembered one thing, sorry. One thing I did want to give you all. If somebody is in crisis, we do have a crisis team, and everybody is welcome to take this number if your staff are really in crisis and they feel they might act on suicidal thoughts and they're really struggling. And that is 019 05 681 915. So that's 019 05 681 915, and that number is on our general website. It is, though, for people who are really struggling. It is a crisis, but if you are really concerned, you can give out that number.
Thank you, Mina. There's just one thing actually, as we're all going, there's one thing. I think my colleague Paul from the Employment Services team is with us on the call. And I just quickly wanted to mention it's something we will circulate. So the Employment Services team are a team within our organisation, and they help to support people back with their employment, and their mental health. And they've created this really good leaflet, which I'll circulate, afterwards, just outlining the range of support for people that have been impacted by coronavirus in regards to their employment. So there's loads of useful contacts within there for people to use. Paul, I don't know if you want to say anything else about that, or anything else about your service, or no? Oh, take yourself off mute.
No, I think you've covered it really well, Kate. Yeah.
Okay, that's fine. But yeah, so just people's employment has been impacted by coronavirus. Now, there is just another thing I want to mention, which isn't about our services, but it's just something else. I was just checking off on the list of what was going to be covered in the session to make sure we had covered everything. And it was about building resilience within an organisation. The one thing we try and do as well as we can is actually to engage with our workforce. And so finding out actually, you know, how staff are feeling, looking at our organisational culture, looking at culture within teams, what's working well, what isn't, where we need to improve, and trying to get that support in for staff. We're lucky we've got an organisational development team, and they offer lots of support for staff and managers, etc., teams in relation to coaching and helping with, you know, building that resilience. But recently we have actually done a survey that's been available for all of our staff to respond to about COVID, and actually how it's affected staff, the range of options that have been available, have they been useful, have staff known that they can access them, and actually what are staff's main stresses at the moment. And I think Ben mentioned earlier on around staff sort of juggling things, and just briefly looking at the results we've had so far from that survey, one of the main things that stands out for me is those staff who are working from home necessarily in place at the moment, and so people are trying to work and juggle everything. So it's just, you know, we're really interested to keep an eye on the results of that survey, just to see you know, how staff are feeling, and trying to do what we can to respond to that, because it's very easy for us to assume that how staff are feeling, what's stressing them, when actually it is individual for all of us. But I think the main thing when doing these pieces of staff engagement work, the most important thing is then actually feeding back. This is what you've told us, and this is what we're going to do about it. And that's something we've perhaps been guilty of in the past of not doing. And then staff think, well, I can't be bothered to engage, because what's the point? Nothing changes. But it's just something, you know, that we, like I said, we're fortunate with having the organisational development team, and they're very supportive with helping to build resilience, but also just trying to keep an eye on, you know, how is our staff culture, how is our organisational culture, team cultures, where do we need to do a bit of extra work? So continuing to try and do those things even at times such as these. Right, I'll stop rabbling on now, but please, if anybody's got any questions or anything they want to mention, like I said, we appreciate that there's lots of you know, different organisations, businesses that you're all involved with, large, small, been affected in different ways by what's been happening. And also the thing I was thinking when Mina was talking, actually life goes on as well. So we've all been faced with COVID, but actually, you know, life goes on. Relationship problems actually may have got worse if people are isolating. People are still dying. So it's all these things that we've still got to contend with on a normal day-to-day basis, as well as then throwing COVID into the mix for everybody. But yeah, so I will stop talking now, and I didn't know if Ben was going to say something then, or if he was just scratching his head. But if anybody has got any questions for us, then please feel free to ask us. Or, you know, I'm more than happy if there's anything that you'd like to contact me or any of us about afterwards. We'll include our contact details when Olivia sends out the information afterwards. And please do feel free to get in contact if there's something else you wanted to talk to us about individually.
Thanks, Kate. I have actually had a question sent to me privately that I definitely can't answer. So I'm guessing it was meant to be sent to one of you guys or into the sort of everyone category. So I'm just going to read it out, and then I'm not sure which of the three of you would be best positioned to answer it, but you can see what you think. So question is, I am the health and safety manager at a large factory with about 150 staff. I've been working throughout the period, ready to get the factory COVID-19 ready and resistant. As some people come back, they are worried. I am not trained in health and safety / stress, particularly for COVID-19. What do you suggest?
Sorry, I was trying to unmute myself then, and I pressed the
Me
wrong
too,
button.
Kate. Well, do you want to go first and I'll follow you up?
Yeah, I was going to say, particularly around health and safety, obviously the Health and Safety Executive website. I mean, I haven't looked at it recently as to see, I'm sure there's lots that's been added to that in relation a stress risk assessment that we use with staff, because again, people's stresses are individual, but by trying to look at them, there might be simple things that can be put into place to try and help alleviate some of the stresses that people are feeling. So our stress risk assessment is not sort of a traditional risk assessment. It's more of actually a discussion tool to be used with staff, covering the sort of 6 different areas that the Health and Safety Executive associate with stress at work: demands, control, relationships, role, change, and support, I think. You know, it just gives prompts as you go through that to try and then establish what the stresses are and what can be done about them. We said lots of people's stresses at this time, yes, they may be in relation to COVID, but they're quite individual to that person. So it's just trying to see what can be done, and often actually just talking about it can, you know, if you can understand how somebody's feeling, can actually help in that situation generally anyway. But it might mean that small things can be put in place to help alleviate some stresses. Ben, did you want to say anything?
Thanks, Kate. Yeah, just to build on what Kate said there, absolutely. You know, these things are really individual, and some of the stresses might be in relation to COVID, social distancing, PPE, all sorts of things like that. Some of them could be more related to something not to do with work, like, you know, I've had to leave my home and I'm kind of worried about how she's going to be doing. So actually just reaching out and finding out how people are doing. But and I love the comment, you know, I'm not a mental health professional, so what do I do? You know, we wouldn't want anyone to leave this call feeling you have to act as a mental health professional, having had a quick discussion with the 3 of us, you know, but one of the things you are very skilled at doing is knowing your workforce and knowing the people around you. And as we said before, just having some of those early conversations, checking up with people. We found, interestingly, in the Health and Care Trust, that in terms of some of that early work around resilience building and looking out for people, some of what really helped staff was the really informal stuff. So we talked a lot about things like water cooler moments, or, you know, kitchen moments when, before COVID-19, you know, how did you get some of your stress relief at work? Well, you might have made a coffee for your mate at work and had a conversation about something. And actually that was really helpful in terms of saying, oh my word, did you see what happened this morning? It was awful, and talking about it, and you leave feeling much better. Of course, with social distancing, we've shut down some of the ways of doing that. So one of the things we've tried to support at the Health and Care Trust was having what we call wobble rooms, virtual wobble rooms, where staff could go in and have a chat together about what was going on. Some teams were doing that already via things like their own WhatsApp groups. Some were using online systems to kind of have a bit of a chat together, but just keeping people socially connected. And I guess Kate's already covered some of the more formal stuff about risk assessment. But again, you know, you can only complete a risk assessment if your staff feel confident to be able to tell you what it is they're really feeling anxious about. And although, you know, you may have some staff coming in and feeling worried, for some of the staff, you know, don't underestimate the value of work being a stabilizing influence in their life. And you may find there's quite a lot of people come back and actually are really glad to get back into the factory and into some sort of a routine, even if it's very different to the way it was before, or equally everything done 2 meters away from other people, whatever the health kind of rules are for your establishment. You may find for some people, actually, they come in and ends up kind of seeming much less stress after a while. So, yeah.
I keep forgetting to unmute myself. The other thing I was just thinking about there is, I think a lot of people's anxieties at the minute, obviously not necessarily helped by the media, and then also rumours at work. So it's encouraging people, if they want the information about what is happening at work and what is going to be happening in the factory when they come back to work, and what the rules and guidance are going to be, go to the right person to ask. Don't listen to your mate who you know text you last night. It's actually go to the right source for the right information, rather than everybody winding themselves up about, you know, we had it a lot with PPE. and staff were getting themselves really upset and anxious. And touch wood, we have never had a problem with PPE so far during this crisis, but actually for some staff, you know, everything that was going on in the media, their friend who was really anxious about it texting them saying, oh, you're going into work and there's no PPE, all that kind of thing doesn't help. So it's making sure the communication channels are open, so if somebody does want the information, they're going to the right place to actually to get it, rather than listening to rumours and being wound up by reading the Daily Mail online.
Can I just add to that as well? One of the things Kate and I did a lot of work around in the early phases of COVID was helping the trust to think about clear, consistent and accurate information. As Kate says, if you're going to less reputable sources of information about PPE, that's really unhelpful. And we did have lots of conversations with staff about how much they were being bombarded with information in the press and social media, and how much do you really want to engage with that every day? Do you want to limit some of that? But if you have information you're sending out about health and safety to your staff, making sure it is clear, it is consistent and it's accurate, so everyone's using the same message. And I guess, you know, we know from the briefings we get from the government each day, when a message is clear and understandable, we can all follow that. When we've had messages that are less clear, it causes all sorts of confusion and anxiety. So we can learn something from that as leads and employers as well about, you know, how do we make sure what we share with our staff is really accurate and based on the information I've got that I know is safe, but also that I ensure that other managers and other leaders are also using that same consistent messages too, or the same consistent message, so we don't end up with mistakes and people kind of misunderstanding what we're doing. And we know that's really important for keeping everyone's general stress levels down. Again, with that idea of this stepped care, early phases are about, you know, clear information, basic safety, looking after myself, you know, way before we start to worry about, you know, psychological responses and things like that. Sorry, Kate, just building on what you've put perfectly there.
The only other thing that popped into my mind with that question was around, you know, I'm not a mental health practitioner, so it's about supporting staff. Shameless plug, I guess, for the mental health first aid training, which is amazing training, which I think should be mandatory across every workforce. I'm sure some of your staff will have done it. I think it's part of Worcestershire Works Well for those of you who have signed up with that. But for anybody who's not heard about it, or you know, there are lots of organisations. It's mental health first aid is available across the county through lots of organisations, and highly recommend it. It's not about you all of a sudden becoming a mental health psychologist, psychiatrist, but it's about looking for signs and symptoms to then knowing where best to signpost somebody onto for the support that they need. So for any of you, you know, I'd highly recommend you looking into that as a means of supporting staff mental health within your workplace. Is there any more questions?
Yeah, I was just going to go on to, for maybe kind of the last 5 minutes, just conscious of time, it goes so quickly, doesn't it? Has anyone else got any questions that they want to ask, or any advice they might find really useful? I'll just leave the chat open for a minute then. If anyone's got any comments or questions, pop them in there, just to give everybody a minute just to sort of type them out. I am going to go over a couple of other things that I think some of you might find really useful. So 2 upcoming webinars that we as a chamber are delivering. One is this week on Friday. We only launched it yesterday because of the timing that it came out with. For anybody that is interested in part-time furlough, which was obviously announced over the weekend on Friday, we're doing a webinar with MFG solicitors this Friday at midday. If you'd like to book onto that, then let me know. It's a completely free webinar. We've also then got a webinar which is going to be based around redundancies, again with one of our local solicitor firms. That's going to take place on Thursday the 11th, which is Tuesday next week. They're completely free to chamber members, so that's part-time furlough on Friday, and the following Tuesday all about redundancy. So if anybody wants to go to either of those webinars, then let me know. The other thing I just wanted to mention for those that are members on this webinar is, and hopefully you are aware and have been made aware by your account managers, is that we do offer a service through the membership called Quest, which is a 24/7 helpline all to do with HR and employment issues. So if any of you haven't had access to that before, obviously it's in very high demand at the moment, but as chamber members you do have a free helpline to that service 24/7. So let me know if you haven't heard of that before, you don't know what a number is, you don't know where to start. If you want to use Quest as a membership service, then let us know and we will help point you in the right direction. Again, completely free to chamber members. I think that's probably given everyone enough time if they had any more questions. So I'm going to go with a no to any more questions. Okay. Probably just a massive thank you then to all three of you. So thank you, Ben, Mina and Kate, for sharing all of your knowledge with us this afternoon. I'm sure everybody has found it really, really useful. I will send out the follow-up email this afternoon. So everything that Kate, Mina and Ben have mentioned in terms of documents, links, they're going to send to me this afternoon, and I will circulate to everybody on this group a little bit later. So hopefully you'll find that really useful as well. The three of you, if you're happy as well, I'll share your contact information. So if anyone has got anything specific, they can get in touch with you directly. Nodding heads, that's good. Okay, well, thank you very much then, everyone. Thank you all for joining. I hope you found it really useful. And again, a massive thank you to all of our speakers for joining us and sharing everything as well. And I look forward to seeing you soon. Thanks, guys.